We are talking about gonorrhea and what behaviors can cause the transmission of gonorrhea, what behaviors do not cause the transmission of gonorrhea. I'm also going to tell you what the symptoms are, okay? First thing, let me start out by saying that gonorrhea is a bacterial infection. It's considered a sexually transmitted infection, so it's a bacteria that typically infects the mouth, the anus, and the genital tract. But the good news here is that it can be treated with antibiotics, okay? So that's the first and foremost thing I want you to know. Now, let's start out with how it is transmitted, okay? And then I'm going to tell you how it is not transmitted. First of all, it can be transmitted through vaginal sex with someone who is infected, okay? It can be transmitted through oral sex with someone who is infected. It can be transmitted through anal sex with someone who is infected. And also, pregnant women who are not treated for gonorrhea can pass it to their unborn child during childbirth. So that's important to note. There are also a couple of other situations that I just sort of want to parse out and let you kind of know. Like, for example, if you were to get infected fluids, right? So it can be semen, vaginal fluids, infected fluids. So these fluids have gonorrhea in them on your hands, and you were, say, to touch your eye, you could become infected with it that way as well, okay? And then the other thing that can happen, or I just want to remind you, is that, you don't have to have full penetrative sex to get gonorrhea, okay? So a penis does not have to go fully into an anus or to a vagina to cause gonorrhea, because really it's about the fluids. It's the semen, the precum, the vaginal fluids, which contain the bacteria. All you need is a little bit of that that connects with a vagina or an anus or mouth or whatever that is not infected to transmit the infection. Okay, does that make sense? So I want to be very clear about that. You don't have to have full penetrative sex as an example. Okay. Then let me talk about what does not transmit gonorrhea, because I think this is really important. People often wonder, like, can you get STDs or sexually transmitted infections from a toilet seat? The answer to that is no. I'll link a video here that I did about that, and I'll kind of go through that just to flesh it through just a little bit more so you can see that. But also, you do not and cannot get gonorrhea from hugging someone. You can't get gonorrhea from holding hands with someone. You can't get gonorrhea from kissing someone, okay? Assuming that the part of the body that you're kissing is not already infected with gonorrhea, okay? You also can't get gonorrhea from sharing, say, utensils, food and drink, and things like that. That is really, really important, because sometimes we see on TV these scenarios where somebody will get gonorrhea and they'll be like, oh my gosh, can I kiss them on the mouth? They've gonorrhea, like, am I going to get it? Blah, blah, blah. So I just wanted to sort of explain where you don't get it from, okay? But let's now go to, before I tell you some of the symptoms, let me just remind you that the best way to protect yourself, or rather, let's say the most foolproof way to protect yourself, is through abstinence, okay? Abstinence is the only 100% way to not get gonorrhea, because you're not putting yourself in a situation. But second best to that is wearing a barrier method, wearing condoms, okay? Also getting tested for STDs, getting your partner tested if you are positive, abstaining from sex, getting treated, etc. Those are the sort of next best ways, all right? I would also say minimizing your sexual partners is very, very important. Why? Because it reduces the likelihood that you come across someone with gonorrhea, okay? Being monogamous, that reduces your likelihood of coming across gonorrhea. And then, of course, being open and honest with your partner is very important. Now, let's talk about the symptoms of gonorrhea, okay? Let's start with men. And the symptoms for men and women are a little bit different in that men sometimes can seem to have more sort of present or prominent symptoms. So symptoms that men can get: discharge from the penis. It can be a yellowish discharge. It can be a greenish discharge, okay? It can burn, okay? The penis can burn, all right? Also, men can get pain with urinating, all right? Sometimes men can get painful or swollen testicles. This does not always happen, but it can, all right? Now, I should also say that men don't always get these symptoms. The symptoms may be more mild or really kind of like, like not many at all, right? So don't just assume, oh, I don't have that, so I don't have gonorrhea. No. Can't assume that, okay? Women, on the other hand, it's just a little bit different, okay? So women might have, say, bleeding, a little bit of bleeding in between periods, okay? Also may have pain with urination, may have sort of increased discharge from the vagina, but also may not actually have any of those symptoms at all. That's a possibility too. So don't use symptoms to guide whether you get tested or whether you use protection, because some people won't have symptoms. Let's talk about anal symptoms, okay? So gonorrhea that's infected the anus, it's very common to have discharge from the anus. Also, anal itching or like irritation. So the anus will be irritated. There may be some soreness in general and maybe some bleeding as well. And also may have painful bowel movements. Okay. If you have any of these symptoms, regardless of whether you think it's gonorrhea or not, you need to get tested and checked out because it could be something else. What I should say too is that when and should one have gonorrhea and they don't get tested and treated for it, the infection doesn't just go away on its own. What actually can happen is it can travel and sort of, I don't want to say spread, but it can travel and cause problems in other places. So pelvic inflammatory disease in women is something where, it can actually affect other organs. Reproductive organs can actually contribute to rates of infertility and other problems. You don't want to let gonorrhea go untreated. You got to get treated. With men, it can sort of affect the prostate and the testicles. So again, you got to get this stuff tested and treated. But in terms of, how gonorrhea is spread, I hope this is helpful for knowing how it's spread and how it's not spread. Do not believe the hype. Remember, condoms really are your best friend. Condoms are very, very important. I have other videos on syphilis, herpes, etc. I'm going to link those videos here. If you feel like sharing, I think it's, look, feel free to share in the comments. Also, the other thing I'll tell you too is I think sometimes people get offended. Sometimes people get offended when you ask them to get STD tested, when you ask them, what's your history? But as a family doctor, I'm here to tell you that your partner shouldn't be offended by you asking, okay? Obviously, we always want to be sensitive and be thoughtful and mindful and be caring, right? But this is, your sexual history is something that if you're sexually active with someone else, they have a right to know, just as you have the right to know theirs. And it's important to make sure you're getting tested and treated and that you're being kept safe and that you're keeping other people safe. So please don't let anyone sort of bully you or pressure you into thinking that talking about this stuff is somehow means you don't trust them, because I'm telling you as a family doctor, you should be talking about this stuff. Guys, I'm Dr. Jen Caudle, practicing family physician. I'm an on-air health expert and video creator. I do daily videos. Hey, write in the comments. Tell me what you think. Was this video helpful? Let me know your experiences if you would like to share. It always helps other people, to be honest with you. Gonorrhea is one of the most common STDs out there. It is not uncommon, unfortunately, but again, with proper protection, the rates can go down. I'm on TikTok, Instagram, LinkedIn, WhatsApp, Threads, Twitter. Did I say everything? I don't know. I'm on all these. I'm on Facebook. Please like and follow my page. Sign up for my free weekly health newsletter at drjencaudle.com. Guys, I'm Dr. Jen. Love y'all. And please be safe.